Good afternoon. I'm Dr. Deepa Isho. I'm a senior consultant in the Department of Pediatrics and Neonatology, and I'm here with an important topic as a part of the series of topics that we have been doing from the Department of Pediatrics and Neonatology. Today my topic is adolescent vaccination. All of us know during this COVID pandemic what an important role the COVID vaccines have done in bringing life back to almost near normal. During this last wave that we had, we've seen that those who had been vaccinated had milder infections and had had a certain amount of protection from very severe illnesses. So we can see how important vaccinations and what an important role vaccinations have played in the prevention and in the control of diseases. So today I'm going to be talking about adolescent vaccinations. Now, what is this period of adolescence? The WHO says that the age group between 10 and 19 years is what adolescent period is. Now, this is a period of transition when they are transitioning from being children to adults. So this is an important period in their life, and they have their own conditions and diseases that they are very prone to, and it is important that they are up to date with their vaccinations so that they are able to lead a healthy life. So why are adolescent vaccinations important? Adolescent vaccinations are important because most of the vaccines that we've given in early childhood, that is in infancy and in early childhood, their immunity starts waning or decreasing by the time the child reaches the adolescent age. Just as you see the COVID vaccines, they realized that after taking 2 doses, the immunity started coming down after a couple of months and a booster shot was needed. Similarly, there are certain conditions where the vaccines have been given in early childhood, but when they reach the adolescent period, the immunity offered by these vaccines comes down, and therefore these children need a booster shot. A typical example of this is the vaccine against diphtheria, pertussis, and tetanus. So these children get it at 6 weeks, 10 weeks, 14 weeks, 1.5 years, and then again at 5 years. But there is an important booster of this vaccine to be given at 10 years, and then again at 16 years. So it is important that these vaccines are given, these booster shots are given, so that the decreasing immunity is again boosted up. So that is one reason for adolescent vaccination, that is to boost up the immunity that is decreasing by vaccines given in early childhood. Then there are some conditions that are very typically the diseases that take place in adolescent age group, and it is important that the adolescents are protected against them. For example, conditions such as mumps is more prone, older children are more prone to it. Mumps is usually seen in children above the age of 5 years, and adolescent children do get diseases such as mumps, and they can land up with complications, especially boys. If they develop, there's a complication known as orchitis where they have an inflammation of the testes, which can lead to problems later on in life. So vaccines such as MMR should be given to adolescents if they have missed their earlier shots so that these children are protected. Similarly, rubella. Rubella is a condition which, if it affects mothers in the antenatal period, it can cause problems in the fetus. It can cause congenital anomalies in the fetus. Similarly, chickenpox is a condition if the adolescent girls are not protected against them. If they get an infection in the antenatal period when they enter married life, the fetus can get affected. And these are conditions that can be prevented by just getting a vaccine. So there are certain conditions that are very common in adolescent age group which vaccines can prevent. Similarly, we see that a lot of children get their regular vaccinations. Till the age of 2 years, most parents are very meticulous in taking their children for all their regular vaccines. So most often we see an upward shift in the age of certain conditions. For example, varicella, we see that it's much more commoner in older children nowadays because older children have not got their vaccine. And when an attack of chickenpox takes place in an older child, they tend to get a much more severe illness. And apart from that, it means missed school days. Just imagine a child who's going to take their board exams getting a bout of chickenpox. It means loss of their board exams. So you can see that can be prevented by just taking a vaccine. So hepatitis A is another condition. Children get it at the age of 1 year and then again at 1.5 years. So if an adolescent child has missed getting the vaccine, they're prone to develop this infection, especially because they are eating out more, and this is a foodborne illness. So you see that there are many conditions. There is an upward shift of these diseases. Small children are protected against them because they get their vaccines, whereas these older children who have missed their doses are more prone to develop these infections. Again, as I said, there are some conditions which cause much more severe illnesses in adolescents than in early childhood, a classic example being chickenpox. So you can see that these are some of the reasons why adolescent vaccinations are important. Then there are some vaccines that are given to adolescents which will prevent conditions that they can get later on in life. A classic example of this vaccine is the HPV vaccine, or the human papilloma virus vaccine, which tends to protect children, girls, from a very dreaded condition known as cancer cervix, which they can get later on in life. And it prevents other forms of cancer also, such as cancer of the vagina, of the vulva. It prevents anal cancers in both boys and girls. It prevents a lot of head and neck cancers. So can you imagine, just giving a vaccine can protect these children from a dreaded disease such as cancer later on in life. And there is a window period that we are given. Usually HPV vaccine is given between the ages of 9 to 16 years in boys and 9 to 26 years in girls. So you can see that there is a very narrow period during which we can give these vaccines to these children, and the adolescent period is a typical time when we can give these vaccines and protect these children from these dreaded diseases that can take place later on in life. So you can see that these are all the reasons why adolescent vaccination is important. So as I said, to boost up the waning immunity, to protect them from conditions that can cause much more severe illnesses in adolescence than in early childhood, to protect them from conditions that are typically seen in the adolescent age group, to protect them from diseases that can happen later on in adult life. Last but not the least, an advantage of giving adolescent vaccination is every time you bring a child into the hospital for a vaccine, it is an opportunity for the pediatrician to do a complete health check for the child. So the growth of the child is assessed, development of the child is assessed, the nutrition, the diet of the child, the sleeping habits of the child is done. So it's almost like a master health checkup where we screen the child for conditions that can be picked up. And so it is almost like a preventive health check done for the child. So it's important that parents have that kind of an examination done for these children when they bring the children in for the vaccination. So it is a point of contact for this. So this is also an added advantage of giving the child their vaccinations. So you can see that there are numerous benefits for it. In spite of all these benefits being there for adolescent vaccinations, why is it that we find many children lacking and they have missed their doses in the adolescent period? Many times we see children who walk into the hospital for other conditions, either with an injury or maybe with a fever. And when we ask them for their vaccine history, most of them, the last dose that they've got will probably be at the age of 2 years, some of them at the age of 5 years. Many times we feel parents are not even aware that there are vaccines available for children, for older children. So lack of awareness is one of the main reasons, and that is the reason why we are doing this kind of a talk. We are hoping that we will be able to create an awareness that vaccinations for adolescents is important. The other reason probably is because parents feel that children are older, they probably have their own immunity, they probably will be able to fight off the infection on their own, and it's better to get that kind of a natural immunity than giving them an immunity through a vaccine. This is always not true because, as I said, many of these illnesses, adolescents don't have a very mild infection. They go through a much more severe form of the illness. It means more morbidity. It means loss of school days. It can mean loss of important milestones in their life, for example, a board exam or an important interview. And these are all things that we can prevent by getting a vaccine. And the immunity provided by vaccines is equally good. So as we always say, prevention is better than cure. So it's always better to give them the vaccine and prevent the disease than allowing the child to go through the illness and thinking that the natural immunity will provide a better cure. So that is probably the second reason that many of the adolescents miss their doses. Then, of course, the fear of side effects. Most of the vaccines, almost all the vaccines that are marketed have undergone stringent trials, and a lot of safety tests are being done, and they are absolutely safe when they are marketed. vaccines can cause side effects, but most of the side effects are very mild, usually a mild fever or pain, which is usually taken care of by paracetamol. Most of the vaccines do not cause any other major side effects, and that is the reason why we keep the child in the hospital straight after a vaccine for at least 15 to 20 minutes to monitor them to see whether there are any side effects, and if at all there are any side effects, I think being in the hospital for that amount of time, we are able to pick it up and we are able to handle it. So vaccines are very safe, and that should not be a reason to not take the vaccine. So that is another reason. And then, of course, this vaccine hesitancy from the point of the child. Younger children, small children are unable to vocalize and say that they are scared to get a vaccine. So most of the time they are brought into the hospital and the vaccine is given. Older children are able to verbalize, their fears and their hesitancy in getting the vaccine. And it is important that parents encourage them. And I think as pediatricians, we are here to dispel their fears, to encourage them, and we are here to support them so that all these fears can be removed and the vaccines can be given in a safe environment. So these are all some of the reasons why adolescent vaccination is missed, and I think the most important one is a lack of awareness. Many parents do not know that if they have missed doses of vaccines in early childhood, there is something known as catch-up vaccination. So catch-up vaccination means these doses can be given later on in life, even in the adolescent period. So the types of vaccine we give in adolescence is, of course, vaccines that are given peculiarly in the adolescent period, such as the HPV vaccine. Then booster shots are given, such as the Tdap vaccine or the booster for the DPT vaccine, that is. And then we give catch-up vaccinations. So vaccinations such as MMR, as I said, is an important vaccine. If the child has missed getting it, it's important to get it. It's a catch-up vaccine that can be given. Then varicella or chickenpox vaccine. If the child has not had a bout of chickenpox or has not received the vaccine, we can still give it in the adolescent period. Similarly, hepatitis A, which is a foodborne illness, that also can be given as a catch-up vaccine if the child has missed it. Typhoid vaccine. Children who are much younger, a couple of years back, probably would have got a typhoid vaccine which needed a booster once in 3 years. So it's important that the booster is given. Nowadays you have the typhoid conjugate vaccine which can be given, which probably requires only a single dose or maybe 2 doses. So to give them a longer protection. So typhoid is again a foodborne illness, and Chennai is endemic for it. So, and when children tend to eat out, this vaccine can protect them, because typhoid is a bad disease to get. It means a lot of missed school days, a lot of morbidity. Most of them require IV antibiotics, which can be prevented by just getting a vaccine. So you can see that catch-up vaccinations also can be given. A lot of vaccinations are given for children who have to go into colleges, who have to go and live in hostels, who have to travel abroad. For example, the meningococcal vaccine. It's an important vaccine which many countries abroad make it mandatory for all college-going students to be able to get it. So catch-up vaccination is another kind of vaccine that is given. So you can see we have booster shots, we have vaccines that are given peculiarly in the adolescent period, and we have catch-up vaccinations. All of this can be done in the adolescent period. So, and I have enumerated the couple of reasons why this is being missed. And now to come to, as I said, once again, I'd just like to enumerate the vaccines that can be given. So the COVID vaccine is the first, I would say, that would top the list, because right now we are in the midst of a pandemic, and it is extremely important that we start protecting our children. Though it is known that children do get milder infections, this last wave that we saw children getting very high grade fever with body pain and severe fatigue for about 3 to 4 days, because of the Omicron variant. So it's not that it's a mild infection. Many of them can have things like long COVID, and children who are immunocompromised or who have comorbid conditions can have a more severe illness. And there is a complication that is seen peculiarly in children known as MIS-C, which is known as multisystem inflammatory syndrome in childhood, which is a serious condition that happens a couple of weeks after a child recovers from COVID. So all of this can be prevented by a child getting the COVID vaccine. Right now, the government of India has approved vaccination, that is Covaxin, for children between the ages of 15 to 18. So I would encourage all children who have not got their vaccines to get the vaccine taken. 2 doses are given and a gap of 28 days. Another reason why children should be given the COVID vaccine is because children can carry the infection home. And there might be susceptible people at home, grandparents, or people with other comorbid conditions who need to be protected, who might get a more severe illness. Therefore, vaccinating children is important. Another very important reason why the COVID vaccine should be given to children is because we need to get back to the normal. Children have been affected physically and mentally because of the way they've been kept away from schools, kept away from friends. Online learning has affected their vision. Many of them have got headaches. Many of them have got vision problems. They have sleep problems. Many of them have lack of physical exercise. They've put on weight. Obesity is a problem with them. So there are a lot of issues that children have been facing with this kind of system where we have taken them away from schools and have had a different kind of learning for them. And we need to be able to get back to the normal where children go out and interact and are able to attend school normally. And for that, children have to be vaccinated and they have to be safe. And for that, the COVID vaccination is extremely important. So that would definitely top the list. Then, of course, as I said, the booster, that is Tdap. Tdap is a very safe vaccine. It's given as a booster shot for diphtheria, pertussis and tetanus. And the advantage of taking these vaccines, these booster shots, is that if a child has an injury, they don't have to keep going and taking a tetanus toxoid, a TT injection every time they have an injury, because the T in the Tdap is for tetanus and it protects the child. So you can see how important it is, because children tend to have frequent injuries when they take part in sports or when they play, and it is important that we protect children. And conditions such as pertussis and diphtheria, when it happens in older children, it does cause more severe illness. It can cause complications, even affecting their heart, and so it is important that we protect them. So Tdap is the other vaccine that is important. HPV vaccine is definitely a vaccine that needs to be taken by every adolescent child, because we are protecting them against dreaded diseases that can happen later on in life. Imagine protecting them against cancers of the anal cancers, penile cancers, cancer of cervix, and head and neck cancers. So that is the kind of protection we are giving them. And then, of course, we have vaccines against meningococcal. Meningococcal causes a meningitis or a brain fever, which is an extremely severe condition. It causes a lot of mortality. Many of the children who get this infection succumb to the disease, and even if they recover, many of them are not back to their normal. They tend to have problems, and so it is a preventable, it's a vaccine preventable disease. It's an important disease that needs to be prevented by getting a single shot of the vaccine. So you can see how important that vaccine is. And then, of course, we have a typhoid vaccine, which is extremely important because, as I said, children tend to eat out a lot. They are prone to these foodborne illnesses. The other one being hepatitis A. So that is also an important vaccine that can be given. MMR is an extremely important vaccine, as I said, because it can prevent conditions such as rubella. Varicella vaccine is an extremely important vaccine because, as I said, it prevents complications later on in life, especially for pregnant mothers. So the children should be protected against all of these conditions. So you can see that there are numerous vaccines that can be given during the adolescent period, and I would encourage all the viewers to meet their pediatrician with their vaccine card if they have it, so that the pediatrician can go through and see what are the vaccines that have been missed, what are the vaccines that can be given as catch-up vaccines, what are the vaccines that can be given as booster shots, and what are the vaccines that can be given because of the age that they are in. And even if you do not have your vaccine card, I'm sure if you come and meet the pediatrician, we will be able to start afresh and start again and prepare a chart so that the vaccines that can be given at that particular age group can be safely given to the child. Apart from these vaccines that I've already mentioned, there are certain special vaccines that can be given to children who are, for example, say asthmatics. Children who get frequent respiratory tract infections, who get recurrent wheezes. These children can be given the yearly flu vaccine. They can be given the pneumococcal vaccine, and that will protect their children from the yearly flu and give them a certain amount of protection from pneumococcal pneumonia. So that is a vaccine that can be given after discussion with the pediatrician. It can be given for all children, but especially for children who are prone to these kind of illnesses, children with any comorbid condition, these vaccines are important. Apart from that, there is something known as the JE vaccine, or the Japanese encephalitis vaccine, which is also a vaccine which prevents brain fever. And this vaccine is recommended for children who come from endemic areas where Japanese encephalitis is common. So these vaccines are again for a special group of children. It can be given in the adolescent period, and again it can be given after discussion with your pediatrician. The other vaccine that we would encourage is the rabies vaccine, and we give it as a pre-exposure prophylaxis, especially for children who have got pets at home. So it is good for these children to get this vaccine taken so that they are protected, so that every time they get either a scratch or a bite from their pet dog, they don't have to come running and take the immunoglobulin and the vaccine again. If they get their pre-exposure prophylaxis, it gives them a certain amount of protection. And children who tend to play outside with stray dogs and with stray cats definitely need to get this vaccine so that they are protected. And as all of you know, rabies is a bad disease with no treatment, and there are vaccines available which can protect the children. So these are other vaccines that can be given under special circumstances. So all of these vaccines can be given after discussion with the pediatrician. So here at MGM Children's, in the Department of Pediatrics and Neonatology, we give all these vaccines, and we are available throughout the week, and we would encourage the viewers to come. And if you have any queries regarding adolescent vaccination or any of the vaccines that I've spoken about, please feel free to post your questions in the comment section, and we will be happy to get back to you with the answers. And at any point of time, if you have any other queries, we are available here at MGM Children's to be able to answer any of your queries regarding adolescent vaccination, and also help you in formulating a schedule in which we can safely give all these vaccines for your children. Thank you. Thank you for your patient hearing.